The measurement of skeletal diameter allows for health and fitness practitioners to assess the size and proportion of particular body segments. Both circumference and skeletal diameter measurements are examples of anthropometric methods of estimating body composition. The use of skeletal diameter can be used in some prediction equations to estimate lean body mass. In addition, prediction error may be reduced when using both skeletal diameters and circumference measures to estimate total body density or percent body fat when compared to using only skeletal diameters. Skeletal diameters may also be used to determine a participant's frame size. The determination of an individual's frame size may allow the practitioner to distinguish between individuals who may weigh more as a result of a large musculoskeletal mass compared to those with a greater fat mass. The skeletal diameter is another measure which can provide additional information when completing a comprehensive health screening or fitness assessment. The measurement of skeletal diameter is another technique which may appear simple in nature, but requires skill and experience to be performed both consistently and correctly. The technician must be able to accurately locate specific anatomical landmarks in order to identify the measurement site. The proper amount of pressure must be applied to firmly compress underlying muscle and fat tissues. This may be difficult with individuals who have a large muscle mass or with individuals who are overweight or obese. In addition, these participants may increase the difficulty of locating and palpating the anatomical landmarks. If the measurement sites are incorrect, the error of the measurement will be dramatically increased. To properly assess skeletal diameter, the technician should hold the skeletal anthropometer or sliding caliper with both hands with the fingers placed along the tips of the instrument. The caliper should be placed on the body landmark to be measured. Firm pressure should be applied to adequately compress the underlying fat, muscle, and skin. Pressure should be applied until the measurement no longer decreases. When assessing body segments with a smaller girth, such as the ankle, wrist, or elbow, a small sliding caliper should be used as it has greater scale precision. Each location should be measured 2 or 3 times in a rotational order. The recorded values should be within 0.2 centimeters and the average of the measures ultimately recorded. When assessing body segments with a larger girth, such as the bitrochanteric, biiliac, or biacromial, a larger skeletal sliding anthropometer should be used. Again, measurements at various sites should be taken in a rotational order at least 2 or 3 times, provided the values are within 1 centimeter. The average of the recorded values should then be used. When recording the number or value on the caliper, remember to read it after you have applied firm pressure with the fat, muscle, and skin compressed, and make note of the measurement prior to releasing the pressure. The anatomical reference points for the biacromial skeletal diameter measurement are the lateral borders of each acromion process of the scapula. The participant should be standing upright with the arms hanging at the side with the shoulders relaxed. The technician should stand behind the participant and place the caliper blades horizontally on the lateral borders of each acromion process while applying firm pressure to compress the fat, muscle, and skin. The anatomical reference point for the chest skeletal diameter measurement is the sixth rib along the mid-axillary line. The participant should be standing upright with the arms slightly abducted away from the body. The caliper blades should be placed on the sixth rib of the mid-axillary line and the measurement value recorded after a normal expiration. The anatomical reference points for the bi-iliac skeletal diameter measurement are the iliac crests. The participant should be standing upright with the arms folded across the chest. This allows the technician to have an unobstructed view of the anthropometric caliper. The angle of the caliper blades should be at a 45-degree angle downward while the technician is standing behind the participant. The caliper blades should be applied at the maximal width of the iliac crests. Ensure that you're on the iliac crests and not above them, as the value will have significantly increased error. The anatomical reference point for the bitrochanteric skeletal diameter measurements are the greater trochanters of the femur. The client should be standing upright with the arms folded across the chest. This allows the technician to have an unobstructed view of the anthropometric caliper. It may help to have the participant flex their leg at the hip to find the greater trochanter initially. The caliper blade should be held horizontally while the participant is standing upright with the technician standing behind them. This measurement may require considerable pressure due to a greater subcutaneous adiposity or muscle mass. The maximal distance between the trochanters should be recorded while firm pressure is applied. The anatomical reference point for the elbow skeletal diameter measurement are the epicondyles of the humerus. The participant should flex their elbow to 90 degrees and the forearm supinated horizontal to the ground. Depending on the client, it may help to have the client move the upper arm to a horizontal position with the forearm at a 90-degree angle vertical to the ground. The calipers will be applied at an oblique angle so that the tips of the caliper contact with the medial and lateral epicondyles of the humerus. The anatomical reference points for the wrist skeletal diameter measurement are the styloid process of the radius and the styloid process of the ulna. The participant should flex their elbow to a 90-degree angle with the upper arm vertical and forearm pronated horizontal to the ground. The caliper tips will be placed at an oblique angle on both styloid processes with firm pressure. The anatomical reference points for the knee skeletal diameter measurement are the femoral epicondyles. With the client seated and the knee flexed to 90 degrees, the technician will apply the caliper tips firmly on the medial and lateral epicondyles. The anatomical reference points for the ankle skeletal diameter measurement are the malleoli of the tibia and fibula. The participant should be standing upright with the weight evenly distributed between the feet. This measurement should be taken from a position behind the participant. The tips of the caliper should be applied at an oblique angle on the most lateral aspect of the lateral malleolus and the most medial aspect of the medial malleolus.